I saw a young girl today. She's 28 years old. She was complaining of a large fibroid that was recently diagnosed. It was found on an MRI that she had. Her uterus was up to her belly button, which normally should not be. You shouldn't be able to feel it. The good news was that this large fibroid, that's probably about this big, was coming off of a stalk and attached to the uterus separately. So if you imagine a ball attached to another ball through a small little attachment. So we talked about different ways of removing it. One way would be to do it open, where we make an incision into the abdomen and get in and remove the fibroid. Another way would be to do it laparoscopic, which means you do a small incision in the belly button, and then you do two small incisions on the side of the pelvis for the hand instruments. We basically remove that little stalk that connects the fibroid to the uterus. Now the question becomes, how do you remove this large fibroid out of a small 5 millimeter incision? So you can do what's called a morcellation. Morcellation is basically an instrument that is able to remove the fibroid piece by piece. Over the last several years, there's been a lot of controversy about the use of morcellator. A lot of hospitals have banned the use of it. A reason for this is that there's about a 1 in 1,000 chance that these fibroids can be cancerous, or they can be a sarcoma. With the use of the morcellator, that cancer can spread inside the patient's abdomen, and it increases obviously the staging of the cancer, because now it's spread versus before it was localized. There are other hospitals that still allow morcellation if the patient is consented well and they understand the risk. There are hospitals that allow it to be used. The hospital that I use still allows it. So the discussion with this patient was exactly the same thing of what do we do? Do we remove it through a morcellator, or do we do it open? The advantage of a laparoscopy is that the patient will recover faster relative to an open abdominal procedure. So in a young woman, where if we have a point of reference to see how fast this fibroid had grown, if it's a slowly growing fibroid in a young woman, I think most people would feel comfortable using a morcellator. But if it's a fibroid that has been growing pretty fast, or if it's in an older woman, generally speaking, older meaning over age of 40, then you need to question the use of the morcellator and probably do the case open.